Anesthesia is a medical intervention used to induce a temporary loss of sensation or consciousness for the purpose of performing medical procedures or surgery. There are different types of anesthesia, including general anesthesia, regional anesthesia, and local anesthesia. Each type works differently, but they all aim to achieve the same goal of making the patient comfortable and pain-free during a procedure. Here's how each type of anesthesia works. General anesthesia. General anesthesia induces a reversible loss of consciousness and sensation throughout the entire body. Mechanism. General anesthetics typically work by affecting neurotransmitter activity in the brain. They enhance the activity of inhibitory neurotransmitters, such as gamma-aminobutyric acid, GABA, which suppresses neuronal activity and leads to unconsciousness. General anesthetics can also inhibit excitatory neurotransmitter systems, such as the NMDA receptor, which further contributes to their sedative and analgesic effects. Administration. General anesthesia is usually administered through inhalation, inhaled anesthetics, or intravenous IV injection, intravenous anesthetics. An anesthesiologist monitors the patient's vital signs throughout the procedure to ensure safety and adjusts the dosage as needed. Regional anesthesia. Regional anesthesia blocks sensation in a specific region of the body, such as an arm, leg, or the lower half of the body. Mechanism. Regional anesthesia works by injecting local anesthetic medication near the nerves that supply sensation to the targeted area. By blocking nerve signals, regional anesthesia prevents the transmission of pain signals from reaching the brain. Types. Common types of regional anesthesia include epidural anesthesia, injected into the epidural space surrounding the spinal cord; spinal anesthesia, injected into the cerebrospinal fluid surrounding the spinal cord; and nerve blocks, injected near specific nerves. Local anesthesia. Local anesthesia numbs a small specific area of the body, such as a tooth or a small surgical site. Mechanism. Local anesthetics work by blocking nerve signals in the area where they are applied or injected. They do this by inhibiting the conduction of action potentials along nerve fibers, which prevents the transmission of pain signals to the brain. Administration. Local anesthetics are usually administered topically, applied to the skin or mucous membranes, or through injection directly into the tissue near the surgical site. In all cases, the goal of anesthesia is to ensure patient comfort, safety, and pain relief during medical procedures. Anesthesia is administered and monitored by trained medical professionals, such as anesthesiologists and nurse anesthetists, who assess the patient's medical history, individual needs, and the requirements of the procedure to determine the most appropriate type and dosage of anesthesia.